Hi everyone, thanks for tuning in to Inside the Training Room presented by OrthoCarolina. I'm Mike Moore with National Amateur Sports. I'm excited to welcome you to the debut of this new series. Over the coming months, you'll hear from sports medicine experts at OrthoCarolina as we discuss common athletic injuries and how to keep your student athletes safe and ready to play. Tonight, we're talking all things ACL injuries and meniscus tears, from the anatomy of the knee to injury prevention. Dr. Piasecki is a former collegiate swimmer and water polo player and former Olympic flat water kayaker. He attended Vanderbilt Medical School and has some of the most prestigious orthopedic sports medicine training, with his residency at the Hospital of Special Surgery in New York and sports medicine fellowship at Rush University in Chicago. I want to remind everybody that you can put your questions in the chat, and we'll get to those at the end of tonight's presentation. Dr. Piasecki, welcome to Inside the Training Room.
Thanks for having me, Mike. It's great to be here.
All right. We want to talk about the ACL, a very common injury. If people, the layman knows about a common orthopedic injury, it's the ACL and the meniscus. But we're not going to assume anything, so let's get started. These injuries not only cost athletes time off the field recovering, but left untreated can alter the health of an athlete's knee permanently. I understand you do more ACL surgeries than any other physician at OrthoCarolina. How common is an ACL tear and a meniscus tear?
Well, so they're very common injuries. We all see these in sports medicine when it comes to the type of injuries that most athletes encounter, particularly the more common sports, all the sports that nobody can do right now with the whole COVID deal. Those are the sports that typically will cause ACL tears. So basketball, soccer, really any type of activity that involves changing direction can give you an opportunity to tear the ACL. And it probably happens more than we even see it in the office, but something around 200,000 athletes a year in the United States will end up with an ACL tear that requires a surgery. So it's a very common injury. One of the most common things we're looking for on the sidelines and in the training rooms for all the sports that we cover.
What's the importance of the ACL and the meniscus in the knee?
So the meniscus actually is more important than the ACL, believe it or not. The meniscus is a shock absorber. There's one on the inside part of the knee and one on the outside part of the knee. And the meniscus basically acts as the guardian of the cartilage inside your joint. So if you have the meniscus working the way it's supposed to, the cartilage stays healthy. And that's one of the main reasons we develop arthritis in later years in life. If you have an injury to the meniscus, you'll end up with an accelerated loss of cartilage and early arthritis. So the meniscus is really there to protect the health of the cartilage. The ACL is really important for two reasons. Number one is for function, and that's because you need that ligament basically to keep your knee from twisting on itself and giving out when you do a change of direction in a sport. Like if you're a soccer athlete and you pivot and change direction, if you don't have the ACL in your knee will give out on you. So you may not be as good a player if you don't have it, but it can affect people who are even just trying to keep up with their kids. You know, that you've got a young toddler who's trying to run away from you, and like mine were when they were little, they tried to beeline it right for the road and try to kill themselves at every chance you're trying to get to your kid, and you can't change direction. So the ACL is very vital for that. So function of the knee in terms of twisting. And then it's important for the health of the knee in a similar way as the meniscus, mostly because if you don't have that stability in your knee that the ligament gives you, and your knee is regularly pivoting in a way that it will, if you don't have the ligament, you'll often tear the meniscus. So the two are linked together, because if you don't have an ACL, it's almost inevitable if you're active that you'll tear the meniscus, and the meniscus, if you don't have it, will lead to arthritis.
Yeah, a lot of people think about the ACL and the meniscus as a short-term injury, something that happens, you get surgery, you fix it. But how can it affect an athlete long-term?
Yeah, so that is the biggest issue that we run into, actually. In fact, one of the main problems with this injury is it's very common in the initial injury phase. You'll have pain and swelling, but then it actually gets kind of better. It feels better. A lot of athletes will think, I just sprained my knee a little bit worse than normal, and now it's back to being its old self, and they'll just continue and play through, even if it feels a little bit different. And the issue we run into, I guess, are those two issues that I mentioned about the ACL before, and that If you don't fix it, you'll probably take something off your performance long term, but more importantly, you'll put your knee at risk for causing damage, more damage to the meniscus and subsequent damage to the cartilage. So we see a lot of athletes who either ignore the injury or don't even realize they've had it, have early wearing out of their knee, and it shortens their careers, and it impacts their life well beyond sports into adulthood and all the things you want to do after you're done playing sports.
Is there anything that can be done to prevent those long-term effects?
Yeah, the best way is prevention. Prevent the meniscus from being injured further and stabilize the knee. So treatment for these injuries is definitely something we try to have an opportunity to provide for patients. So if we see athletes that are healthy, and really anybody who's active enough to injure the knee in this way is often someone who would benefit from having these things treated. And usually that ends up meaning a discussion about fixing these things to give them back the function that they need.
Yeah. If we watch sports, we see a lot of knee injuries happen from contact, from non-contact, all different ways. But how can an ACL or a meniscus injury occur, and what kind of injuries do you see most?
So the most common way that people will tear the ACL typically, and the meniscus will typically tear at the same time, is with what we call a non-contact twisting injury. So this is actually a pretty innocuous type thing. In fact, I'll see many, many parents each year with their kids who come in and say, look, nobody even hit them. I mean, they were just running down the field by themselves, and then their knee kind of did something funky and they fell down. It's usually not with a tackle or contact with another player. It's, again, that change of direction where you plant and try to move your body quickly, and that force goes through the knee in such a rapid way. If it strikes the ligament in just enough force, it'll cause it to tear. So this non-contact twisting event is what we typically see. And the classic explanation that patients will give us is, I heard a pop. And you'll hear pops all the time. I know, in our age group, we hear pops constantly, but this is a loud one. In fact, a lot of players who are nearby, teammates, will say, I heard it too. It's usually a pretty loud pop, and what's actually happening when that occurs, the ligament inside the joint is tearing, and you'll hear that noise. And then soon after that, the knee will swell. It's a very classic story. We'll hear, I was doing fine, nobody was even close to me, I felt this pop, searing pain in my knee, I fell down, my knee ballooned up with swelling, and that's a pretty classic story for tearing the ACL.
One of the terms I hear a lot sometimes is hyperextension. Is there a difference between a tear and a hyperextension?
So hyperextension is really what that's referring to, is the knee getting too straight. So you can tear the ACL in a hyperextension event, but if you imagine your knee is like, this is straight and this is bent, hyperextension is where it goes like that. So when the knee hyperextends, it actually can cause a lot of injuries to a lot of other structures. Usually a hyperextension event will cause more of a sprain on average. But you can tear the ACL doing that as well.
So say an athlete hurts their knee, or their knee hurts, they're seeing a little bit of swelling, but they're still able to move around. How do they know when they should come in and get it evaluated?
Good question. I think swelling is one real sign that something significant has probably happened in the knee. And it's not just a little puffiness, but it's if you look at your knee and you're like, there's a watermelon in there. I mean, if it's noticeably, visibly bigger than the other joint is, then something, and you can even feel it. Some athletes will come in and be like, I can feel there's like a gallon of water in this thing. If it swells like that, you definitely need to be seen. And that doesn't necessarily mean that you've done something terrible, but it's a sign that something has been very irritated within the joint, which is not normal. So swelling like that, that's one thing. The other is if they have enough pain, they can't put weight down on the knee. That's your body saying, you really irritated something badly here. Those are the two main issues. And then there are other obvious things. If you were to tear the meniscus badly enough, for instance, sometimes you'll get a little bit of tissue that'll get stuck in the joint, and your knee would be locked. I mean, these are obvious things. These are things my grandmother would say, you got to go. But the swelling and the pain are the two most common.
Okay. So it gets bad enough they need to come and see a doctor. What should they expect when they see you about the evaluation?
Well, we typically do. I mean, the first thing we do is try to get the story. What happened? Tell us how you injured your knee. What exactly occurred? What position were you in? What did you do? Because there's a lot of information we can get just from the story of how they were hurt. And I spent a lot of time trying to get that information because how you tear the ACL is different than how you might tear a tendon in the knee or another ligament in the knee. And that classic story is one of the things I'm looking for, is a non-contact twisting injury. It's very common. So how did you injure it? And then we'll do a brief exam, and we're gentle. We're surgeons, but we're really gentle people too. We're not trying to hurt people, obviously. So we can figure out a lot just with a very gentle feeling of the joint, moving it very slightly, and examining the ligaments in a way that's not craziness. And then if we think it's indicated, we'll often talk about getting some imaging studies like X-rays or potentially an MRI. And those things together usually will allow us to tell patients, look, this is what's happened and this is what we think you ought to do about it.
One thing I'm curious about is, do you see a lot of these kinds of injuries in children that are maybe pre-junior high or pre-high school?
We do. We see ACL injuries are common across the board, but it's kind of interesting that you mentioned that. It definitely happens in young kids that are still growing, even in like elementary school. We will see that, but actually, it's less common in those age groups than once you get into high school and college. And most of that is physiology, because kids, when they're that young, and I tell my kids all the time, you don't know what it's going to be like when you get older. You just don't. I feel like someone should have told me that at some point. I never got that when I was a kid. But
yep.
My kids, they're in their early teens and early adolescent years right now, and those kids, they're like rubber, literally. And if they fall and they break something, usually it just stretches. So they can have tears, definitely happens. But usually it's a sprain. So most of the time with younger kids, they actually have to work really hard to tear the ACL. Once you get into your 20s and 30s and 40s, if you do something that's aggressive, changing direction, it's a lot easier.
Yep, that's a good answer. So you've evaluated them. You've decided there's a tear. The meniscus is also torn, or maybe it's torn. What are the treatment options available to the patient?
So we always consider a range of treatment options. So I like to think that and this is true, I think, for all of my partners here at OrthoCarolina, we're surgeons, but really we're doctors first. Surgery just happens to be an option for treatment that we have to treat many of these things. And most of the people that walk in my door, probably 90%, don't need any surgery at all. And so the first thing we're thinking is, are there things we can do that don't involve any surgery? Are there treatments does this even need to be treated at all? Sometimes I'll see an athlete that's had a partial injury to the ACL where they've stretched it a little bit. They may have bruised the meniscus, but not torn it all the way. And we'll say, look, we don't need to do anything here. Let's get you to ice it, work with your trainer, and in a couple of weeks, they're fine. So not necessarily anything. Second option is non-surgical treatment. And sometimes, in rare situations, if they've had an injury that's not bad enough to cause significant instability to the joint, we can actually treat them without surgery. There is a role sometimes for braces and for physical therapy to try to get them back in a way that's safe. And then the third option is of course surgery. And the truth is, for most complete ACL tears where the ligament is completely blown apart and the meniscus is torn, particularly for younger, healthier athletes, usually surgery is the best answer, because we found non-surgical treatment, unfortunately, doesn't usually give them back that function that they need.
Can you talk specifically about grafts as a treatment?
Yeah, sure. So yeah, you'll see a lot about this. What you're describing there, a graft is basically, it's a piece of tissue. And when we go and actually reconstruct the ACL, which is the surgery we do to fix it, we can't repair it because it doesn't have the ability to heal inside the joint. So a lot of patients will ask, well, why can't you just stitch the ligament back together? And it just doesn't work well. The ligament doesn't have the ability to heal. So the treatment for that, the solution that we found that works really well, is to actually remake the ligament. That's what's called an ACL reconstruction. And the way we do that is using a piece of tissue that's basically the same size and same strength as the normal ligament would be. And we have to get that tissue from someplace. That tissue is called a graft, and we can get it from basically two main places. We can get it from a cadaver, somebody who's died and donated their tissue to medicine, or we can get the tissue from the patient themselves. We usually like to lean towards, there's been a fair amount of evidence over the past number of years that using tissue from the patient themselves, which is what's called an autograft, tends to work better, particularly for younger active patients. But allografts, or the tissue from a cadaver, as they're called, those are options as well.
And what kind of different surgeries are available for treating this, from a arthroscopic to full blown surgery and opening up the knee?
Well, you can do it. There are a lot of ways to skin a cat, as many of my mentors, when I was training back years ago, would say. There are lots of different ways you can do these operations. The way that is the most standard way that has been shown to have the least amount of complications and get patients back the quickest is what's called an arthroscopic approach. That means we're using a camera to look inside the knee, as opposed to making a really big, huge incision and opening up the joint. Good results have been reported with the open approach, but that's really not standard of care now. Most of the time, unless there's an extenuating circumstance or a really significant additional injury involved, we'll almost always do it arthroscopically.
Okay, and the last question I have for you is, talk about recovery time after surgery or arthroscopic procedure. How long does it take for a patient to recover and then be back at full strength?
So the recovery time, the quick answer to your question is it depends a lot on the athlete, but it's usually somewhere between 6 and 9 months. They're back doing everything. If it's an aggressive sport that is high risk, so something like football or soccer, or basketball, where they're doing a lot of jumping, the main rate-limiting step actually is not healing of the graft or healing of the things that we do in the operation. It's actually getting back the muscle strength and coordination those athletes need to protect their knees from another injury. And that can happen as early as 6 months, but it may take as long as 7, 8, or even 9 months. And the more we learn about ACLs, the more we're learning that going back slower is usually smarter. So it's not that we make patients or athletes wait an unnecessary amount of time. We're very careful to fine tune it to the athlete, but being careful and being safe, we found, is the best way to make it a one and done deal. We don't want to do any surgery if we don't have to. If we do it, we only want them to have one, and we want it to work, and we want to get them back and do everything that they need to do and not have problems. So usually 6 to 9 months is the answer.
So what are the elements that post-surgery that go into a successful recovery for an athlete?
Yeah, so I think first is expectations, understanding what their problem is and why they're having a surgery, and understanding how long that recovery is, and then going through the different phases of it with eyes wide open and being a full partner in the process. It's a team effort, and I'll often have patients thank me for the surgery when they're done, and really I feel like it's a team effort. Everybody's in the boat together, and most of all the athlete is. So the best successful recovery after the surgery really has as much to do with the athlete as it does the surgeon. And that early phase where most athletes are in a brace for a period of weeks and they're seeing a physical therapist pretty regularly, understanding this is important because I'm optimizing my recovery later. So it's really being on the same team as all of us together, but that early phase, and then we take them all the way through, and we're right there with them, arm in arm, till we get them back out there on the field.
All right, terrific. Dr. Piasecki, do you have anything else you want to add about this subject?
No, it's great. I love it, though. I will tell you, this is my passion my passion are my patients, but I love ACLs. I tell patients all the time, my wife gets on me because I have a real passion for this surgery. I probably do, I don't know, 60, 70 different operations, something like that. But this is the one that really literally gets me up at like 2 a.m. thinking about ways to innovate and change and make it better. And so it's a real privilege to be able to offer that to my patients. It's fun.
All right. Dr. P, we appreciate your time today. Thank you.
My pleasure. Thanks so much, Mike. Have a great day.